On behalf of the Columbia Center for Teaching and Learning, it is my pleasure to welcome you to today's forum on returning to the Morningside classroom with student well-being in mind. Today's event is in service to all who teach and who play a crucial role in supporting student learning, recognizing the impact that wellness has on academic performance. The CTL is committed to supporting instructors and TAs as they meet Columbia students where they are as we transition back to our classrooms. The pandemic has heightened our awareness of connections between wellness issues and our teaching practices, and we want to carry forward these lessons learned in order to create inclusive learning environments as we return to our classrooms. We have highlighted these teaching practices in our CTL resource, Teaching in Times of Stress and Challenge. We are honored to have 5 expert panelists from Columbia Health to speak with us today. They will contextualize wellness issues, provide guidance on recognizing students in distress and getting them the help that they need, share resources to optimize student wellness, and bring attention to your own wellness. Before we begin, I would like to thank these panelists for partnering with us, for preparing these informative presentations, and for their willingness to address your questions. Thank you also to the Office of the Vice Provost for Teaching, Learning, and Innovation and the Office of the Provost for their support of today's event. And last, but for sure not least, thank you to you, our participants, for joining us today in this important conversation.
Thank you, Catherine. Please feel welcome to ask any questions of Catherine or the Center for Teaching and Learning in the Q&A function. Next, we have Dr. Melanie Bernitz, Senior Vice President of Columbia Health, Associate Clinical Professors of Medicine in the Center for Family and Community Medicine, who will address public health concerns and the return to the classroom.
Thank you, Susanna, and good afternoon, everyone. It's a pleasure to be here. And before we get into the real, I guess, meat and potatoes of this conversation around well-being and supported well-being, we did feel it was important to set the stage a little bit to share with you some of the broader pieces. You may have heard me speak on other panels around this, but really just to kind of give you that, that broader setting of this return to the classroom, where we are in terms of the pandemic and our public health approach. So if you wouldn't mind pulling up my slides, please. And we can go to the first slide. Thank you. So really, we like to ground every presentation in just seeing where we're at in the pandemic. And this graph we've shown a lot. We pull this every week from the New York City website, really looking at these different waves of cases that we've seen in New York City, and knowing that our campus is so heavily integrated within the city. And we all remember all too well that high peak we had both last April at the beginning of the pandemic, and then again in the winter in January in our second wave, and that very long and prolonged peak. And that came down very rapidly, and we had a really quite a good spring in New York City. And now what we're seeing now, this third wave, you'll see on the right there with this bump. But there's a big difference here, and you'll see it's a two-part difference. First is the size of that peak. It is significantly smaller than either of the prior 2 peaks. And the second, which is I think the glimmer of good news, is that we really are on the other side of that. We hit the peak, we plateaued, and we do seem to be coming down. So that's looking at cases. Next slide, please. The next one, it shows the same, and it's around hospitalizations. Again, we had large numbers of individuals in our hospitals in New York City back in the April time last year, and then a long, prolonged numbers of hospitalizations again in the winter. And what we've seen now, mimicking those lower number of cases, is actually a significant lower number of hospitalizations. Thankfully, unlike other parts of the country, we've not seen this overwhelming demand for our hospital beds or our ICU beds. And again, similarly, we seem to be over that peak, and that's been borne out with projections from our own hospital system at the medical center, showing that we really, thankfully, are not seeing a high peak. And then the next slide, please. And this documents the number of deaths we've seen in New York City. Obviously, 1 is too many. Very high peak at the beginning of the pandemic. many more lives lost back in the winter, but what we're seeing now are thankfully very small numbers of lives being lost, not to the same extent. And if we go to the next slide, this really shows us why, and it's about vaccination truly being the game changer here. You hear a lot about this in the media. This is the New York City graph, the most recent one. Looking at adults, obviously you can look at everyone else. This is adults 18 and over, all of whom are eligible. And we surpassed 80% in New York City of adults having received first dose and 73% being fully vaccinated. Right now, all those 12 and older are eligible. There's a lot of work being done to get those age ranges vaccinated. We do see lower vaccination rates in the younger age group, and then we are obviously hopeful. We were hearing yesterday that Pfizer is submitting to the FDA for the 5 to 11-year-olds. So hopefully we'll see approval for that age range soon. And the next slide, please. So this, every week we post our campus data on the COVID-19 website, covid19.columbia.edu. Pretty much anything I ever say is found on that website somewhere. And this is the data from last week's testing. We continue to have a robust testing system across campus. We did over 8,000 tests last week and we had 50 positive results. That number is not surprising. We anticipated seeing cases early on in the semester, but the positivity rate is incredibly low and has remained well under 1% throughout. Those tests that are coming back positive are a mix. Actually, the numbers coming back positive on our gateway or our reentry testing are very low. Those are less than 0.2%. So often these are people who've had known exposures and then go on to test positive. We continue to do our random surveillance testing, which really is a way of getting a more precise prevalence estimate of what's going on. And last week of 787 tests, 4 were positive, 0.51%. We know our affiliates also test outside of our surveillance testing program if they're symptomatic. This includes students coming to our student health centers on both campuses for rapid testing if symptomatic, as well as our affiliates using outside testing for whatever reason. And we had an additional 62 positive tests. Those numbers have been pretty stable and really are in alignment with what we expected to see this early on in the semester. Next slide, please. I borrowed these from my colleagues up at ICAP, and I think this really shows kind of where this pandemic has gone. Obviously, what we saw was this global pandemic with multiple cases throughout the world, with a lot of spread going on. What's happened now is the difference that vaccination has made, and it's kind of caused us to go to 2 different zones. In the areas of the world, including the United States, where we have ready access to vaccination, we've moved into endemic COVID. This is where we see isolated clusters and much lower numbers of cases. Obviously, in other parts of the world where there is less access to vaccine, we remain in an epidemic of COVID. But what we're seeing, as you can see on the top right here in the United States, is much smaller numbers. What it also means is this anticipation that maybe, or this hope that maybe we had early on that we would eliminate COVID altogether is not a realistic hope. And that the same way we live with flu every year and other viruses, we anticipate that we'll continue to see cases of COVID. So as you see numbers on campus or known cases on campus, that shouldn't be surprising as we enter this endemic world of COVID. Next slide, please. Another graphic that I think is really important to share as you've all come back to the classroom is the multiple layers of protection we have at the university. Real Swiss cheese model, where not one thing on its own is going to help us address the pandemic, but all of the pieces put together make a much more impenetrable barrier. So this is all the upgrades in our facilities, the training, the compact testing, contact tracing, the indoor masking that we still have, continued restrictions, and obviously the vaccination mandate. Next slide, please. I know I'm almost out of time. I just wanted to touch very rapidly on what happens if we do get a positive case. We anticipate getting positive cases. We do contact trace and we do notify. We get notification from many different sources. We can go right to the next slide, please, because I know I'm almost out of time.
And really, we have a multi-pronged approach. When we do get a positive case, we will interview the case. We'll figure out when they're infectious. The good news is with this fully vaccinated campus, where over 99% have vaccines and only less than 1% have exemptions, most people, even if they're a close contact, either in the classroom or in a social realm, and do not have symptoms, do not need to quarantine. So it really does minimum disruption to the classroom. We tell them to mask, we test them 3 to 5 days after exposure. So the only students in a classroom exposure who have to quarantine are those who are not fully vaccinated, so have a vaccine exemption. And we do this work, and then we do send notifications to the classroom, and many of you may have started to get them. We're starting to send them through Canvas, so that if a student in a class has tested positive, we do, for transparency's sake, notify the faculty and all students in that classroom. Again, not assuming that everyone was exposed, because we have not seen any cases of classroom transmission, but just so we can continue to provide you with that information. And I do know I'm out of time, so I'm going to pause there. This shows all the cascade of events that happens, including the notifications I've described, as well as facilities notifications, but I'm certainly happy to answer any questions around this in the chat. Thank you so much.
Thank you, Melanie. And yes, please feel welcome to ask any questions in the Q&A. And next we have Dr. Richard Eichler, Executive Director of Counseling and Psychological Services at Columbia Health, who will contextualize student well-being concerns.
Thank you for having me. Good afternoon. I'll spend the next few minutes discussing some of what you may see or have already seen in your classrooms this fall, and offer a few thoughts on how best to help your students. What's obvious is that students have a wide range of feelings about returning to campus. Some are excited, while others are fearful, and still others continue to harbor resentment about having had to transition to remote learning in the first place, deprived of the campus experience to which they felt entitled. Among the factors influencing how they feel are their coping strategies, underlying vulnerabilities, and experience with remote learning. Some have had a relatively easy time of it. They've resided in comfortable homes in the company of family members or partners with whom they're close. They've enjoyed good internet connectivity, a reasonable degree of privacy, and an environment conducive to remote learning. Others, on the other hand, and they may feel like they're abandoning the safety of the cocoon with no particular incentive for doing so. By contrast, other students have been profoundly isolated. They've lived entirely on their own with little opportunity for in-person contact with friends or loved ones. Still others have been trapped in toxic family environments that have not been conducive to remote learning, and so forth. Perhaps most often students are ambivalent about returning, which can be quite confusing. They may at once, for example, be eager to rekindle friendships, and at the same time may be anxious about the behaviors of their less cautious classmates, afraid that they'll place them at their health at risk. Now, for some students, other concerns may be as or even more top of mind than COVID. For example, police violence against Black Americans has been on prominent display the last 18 months. While hardly new, this has catalyzed everything from fear to despair to justifiable outrage and anger. Similarly, hate crimes against people of Asian descent have risen by 70%, according to the FBI, by those who've they've been targeted by people who irrationally blame them for the pandemic because of its origins in China. Some members of the AAPI community express fear of everything from microaggressions to outright violence. So, I've heard people say that everyone has been traumatized this past year and a half. And while it's certainly true that very few people have had a good year, blanket statements of that kind, while well-intentioned, as we've seen, are not equally applicable to all students, and moreover may inadvertently play into the unfortunate narrative that students lack resilience and/or that campus is not safe, and we shouldn't have had them return in the first place. Students certainly benefit when faculty show concern, but empathy is best conveyed by listening, by avoiding the trap of presuming that each student has had more or less the same experience of hardship. I think people sometimes underestimate the power of everyday interactions that require no special training in psychology, just a good heart. After 18 months or so, when many students have felt alone and disaffiliated, small expressions of concern from a valued teacher can promote a feeling of human connection that is powerful medicine. There are several studies that dramatically illustrate this point. In one, half of recently discharged psychiatric inpatients was sent simple periodic notes of concern and encouragement. The suicide rate among those patients was less than half as that among patients who didn't receive the simple notes. And those positive effects were still felt more than a dozen years after discharge. Knowing that someone cared apparently helped a good deal. Some students, of course, are going to struggle because their study skills have eroded or because of depression or anxiety that was precipitated or exacerbated by the pandemic. In some instances, learning may be complicated by the lingering cognitive effects of coronavirus. It's certainly not for me to suggest what accommodations may be appropriate, but I will say, however, when it's possible to be flexible within the department's policies and procedures, I think it makes a good deal of sense to do so. Of course, academic standards do have to be upheld, and some students may be angry about expectations that they find hard to meet, as well as the restrictions that may be placed on their social lives here on campus. Here I offer advice that is much more easily dispensed than followed. I think it helps to keep in mind, first, that far more often than not, when students are angry, they're not angry with you as an instructor, as a person, but with the situation in which they find themselves. So try not to take it personally. And second, one can empathize with the student's distress without endorsing their analysis of the source of their upset. Students want their experience validated, and one can validate their experience, for example, that they were stressed, unable to work effectively, fell behind academically, and even that they felt cheated when instruction was virtual. One can do that without accepting their analysis, that is to say, without accepting that they were actually wrong by being asked to leave campus, or conversely, being wrong now by being asked to come back. Finally, it's important to emphasize the distinction between grief and sadness on the one hand and clinical depression on the other. While some of us have been spared the worst consequences of the pandemic, almost everyone has experienced the loss of a sense of predictability and control. Honestly, how many of us anticipated in the spring of 2019 that we would be in the throes of a worldwide health crisis a year later, largely powerless to influence its course? Mourning those losses, including in the case of our students, a year of their college experiences, is understandable and even healthy, so long as it is a means of letting go, of accepting what has happened so one can move on. When one becomes consumed by these losses and unable to re-engage with life, then that shades into depression. Now, majority of our students will rebound, but some will continue to struggle mightily. So my last slide, the graph on the right, which is drawn from data collected by the CDC, shows that the experiences of anxiety and depression, at least by self-report, increased 300 to 400% during the pandemic, with suicidal ideation among our age population, 18 to 24-year-olds, increasing by 250%. Indeed, as the slide on the left shows, it's 18 to 29-year-olds who've been most prone to adverse mental health consequences compared to all other adults. So how do you tell the difference between normative grief reactions and psychiatric problems for which a referral to CPS is appropriate? I'll leave that to the next speaker to discuss.
Thank you, Richard. Please feel welcome to ask any questions in the Q&A for Richard. I see some of the questions are coming in, so thank you for those. Next, we have Dr. Ann Goldfield, Associate Director of Outreach and Community Response in Counseling and Psychological Services at Columbia Health, who will help us recognize, talk to, and get support to students that are in distress.
Hello, thank you so much for having me today. I'm here to speak with you a little bit about identifying and referring students in distress. As Dr. Eichler mentioned, the ages of the majority of our student population at Columbia are also the stages of life when mental illnesses may first present. And as you know, these conditions can include anxiety disorder, depression, other types of mood disorders, eating disorders, substance use disorders, and occasionally the onset of psychotic illnesses. The reason that we're speaking to you today, or certainly the point I want to underline, is that as faculty members and graduate student instructors, you may be among the first to notice signs of distress in your students, and we want to give you some tools to recognize and to help those students connect with resources. So I'm going to show you some slides that have some indicators of distress, and I want to emphasize that the more indicators you notice, the more likely it is that the student does need help. And please remember that we at CPS are here to consult with you about any questions or concerns you have. So academic indicators, these are things I'm sure you're familiar with. Students who are repeatedly absent or miss assignments, if their work deteriorates in quality or quantity, students who appear really disorganized or have an erratic performance may be in distress. Students who express any concerns about violence or social isolation or focus on suicide or death, they may be asking for you to recognize this as a plea for help. We all know that students who constantly or frequently request special accommodations are struggling, and it's important, as Dr. Eichler mentioned, to try to understand what's going on and not assume that they're just looking for special accommodations for, to make their lives easier. And last academic indicator is disproportionate response to grades or other evaluations. Behavioral indicators to attend to are obviously direct statements indicating distress, students who are suddenly more withdrawn or more animated, who express hopelessness or feelings of worthlessness, students who mention severe anxiety or irritability, obviously students who have an outburst of sort of a hostile or aggressive nature, students who are particularly demanding or dependent may be indicating that they're having some serious problems. And a lack of response to outreach from you could be another indicator that they're in distress. Briefly, some physical indicators: physical appearance changes, excessive fatigue, changes in weight, any injuries or noticeable cuts or bruises, frequent or chronic illness when a student is constantly telling you that they're not well. Some of that can be a mental health issue. Students who appear disorganized, who make little eye contact in an unusual sort of way, shaking or pacing, and people who come in seemingly bleary-eyed or on a substance or intoxicated. So pay attention to those indicators, please. What do you do if you have a student in distress? If you have a relationship with that student, it is often the best thing to speak directly to the student. But we do want you to pay attention to how comfortable you are with responding and how much time you can afford to spend helping them. We want you to put your needs as well as the student's needs first. Again, please consult with supervisors or CPS as needed. What do you do when you're going to speak with a student? Speak in a private environment with the student where you won't be interrupted. The caveat to that, of course, is if you feel in any way that there's a risk of harm to you or to anyone else, then you want to be in a more public place. With the student, express your concern and caring. And it's helpful to point out the things that you've noticed. It's helpful to say something like, I've noticed that you're very tired in class a lot and that you're not turning in your work as promptly as you used to. Something specific that you can point to. Listen attentively. And Dr. Eichler mentioned how important it is to validate what the student is saying, and reflecting back what you're hearing can be extremely validating for a student. So saying something like, I hear, from what you're saying, it sounds like a lot of stress, maybe some family problems that are really worrying you and on your mind. I'd like to hear some more about that. And if appropriate, if it isn't an emergency, please consider sharing information about CPS and other resources. So saying something to the effect of, I've talked with other students who have similar concerns, and they really felt that talking with somebody at CPS was quite helpful. So just a kind of a little encouragement to reach out. If there are signs of safety risk, please do ask the student if they're considering suicide. And here are a couple of helpful phrases. Sometimes when people are going through a situation like this, they have thoughts of suicide. Is that something you've been experiencing? Or something like, you've been talking about feeling very down and depressed and hopeless. Are you thinking about suicide? We always encourage people to practice saying that to themselves out loud, just so that you get a little more comfortable using those kinds of questions. Remember that a student who is experiencing thoughts is likely to be very relieved that you've asked about suicidal thoughts. It will not suggest the idea of suicide. That is not going to happen. And it really can reduce the incidence of suicidal behavior, because students who are feeling suicidal or thinking about suicide, if somebody asks them about it, they will most likely acknowledge it. If you don't feel comfortable, you can consult with us. We can help you how to decide how to approach the student or what other options you might have. Here's an important thing for you to know. Faculty are not required to maintain confidentiality. We professional psychologists, psychiatrists, and social workers are required to maintain confidentiality in our roles on campus, but you are not required to maintain confidentiality. And if you promise confidentiality, that might get in the way of connecting that student with help. So please remember that. And if a student says, will you promise not to tell anybody what I'm about to tell you, you can let them know that you're there to be in their, you're thinking of their best interest, and confidentiality is not in their best interest in all circumstances. So if you're concerned about significant distress, you can reach out to someone in your department, to CPS, to the student's advisor, or to the on-call team. We are always available for consultation, and we can answer questions about the level of concern that you have and what some next steps might best be. If you're concerned about your own safety or the student's safety or someone else's safety, as you know, our public safety officers can find you on campus quickly. If you are off campus and the student is off campus, 911 is the appropriate resource. But if it's not an emergency where you feel there's a safety issue, you can again contact us. We're fortunate to have an emergency room nearby, and they are open 24 hours. And sometimes students need to present themselves to the emergency room or have public safety take them there. Just another important resource. Last but not least, a reminder that mental health treatment can really help. So we can help with stress, we can help with emotional distress, coping skills, and to foster resilience. We have seen many, many students over the years, and we have resources available across the campus, and I'm happy to turn this over to my next colleague, who will talk to you a little bit about CPS resources. So thank you so much.
Thank you, Anne, and please feel welcome to ask any questions of Anne in the Q&A. Next, we have Dr. Weiyen Chung, clinical psychologist at Counseling and Psychological Services, Columbia Health, who will present the range of services available to students and how we can help connect students to CPS.
Thank you, Susanna. Hi, everyone. Good afternoon. Let me pull up my slides. Okay. So my name is Weiyen Chung. I'm a psychologist here at CPS, and I'll next be discussing what services we provide once you've recognized a need in your students and how they can connect to us. So to start, our offices are in Lerner Hall on the 5th and 8th floors. Our hours are shown here. And the good news is whatever you've been doing to get the word out about us has been working well. We see over 50% of students from the undergraduate schools and over 20% of graduate students, which means we see over 6,000 students a year, the majority of whom say they feel satisfied with our services. As outlined here, we offer short-term individual counseling, support with referrals for longer-term treatment in the community, medication management, crisis intervention, consultation, drop-in hours, and support spaces, all of which I'll be speaking about in more detail shortly. An important point to emphasize here to your students when discussing connecting with us is what Dr. Goldfield had mentioned previously, that we adhere to strict standards of confidentiality, which can help a student feel more open to speaking with us. And as you can see here, the number listed is a 24/7 number. So even if our offices are closed, I've let students know that 2, 3, 4 in the morning or on the weekends, they can always call that number to speak with a clinician on call. At CPS, we have an incredibly diverse team with a range of disciplines, a range of areas of expertise, a range of racial and ethnic backgrounds, with over 12 languages spoken collectively. One way you can support your students in being intentional about seeking our services is by directing them to our website, where they'll see these subheadings under our services. For example, if a student said they were struggling with poor body image, overeating, or undereating, they could click on the eating disorders heading, which would then take them to our page that describes our eating disorders team, as well as a brief bio of each of the team members, whether they're from CPS or medical services. We also have our staff bios on our website, so students can be selective about who they might want to meet with based off of clinical focus, or a psychologist who might share an aspect of their identity or experience. Which brings me to the ways students can connect with us. Students can now schedule a brief initial treatment planning session online or by calling us. These sessions are over the phone or by Zoom and allow for a brief assessment of the concerns the student is experiencing, at which point they may be provided referrals for off-campus services or be scheduled an intake with us, which are always in person. Another way students can connect with us is through problem solving or urgent mental health concerns drop-in hours. Problem solving drop-in hours are located in our satellite offices. Students can see on our website what's open now. And typical issues that bring students to problem-solving drop-in are relationship issues, adjustment issues, academic anxiety. And the focus of those sessions is on strengths-based interventions that help the student identify their effective strategies, maybe arm them with new ones, and help them identify who their supports are and point them in the direction of any appropriate resources. Urgent mental health concerns drop-in hours are located on the 5th floor of Lerner Hall and are Monday through Thursday, 6 to 9 p.m. with the last check-in at 8:30. And students that access these drop-in hours tend to be in a more acute state of distress. They may be expressing concerns about their safety. And the focus of these drop-in hours is also brief intervention, but for safety planning and stabilizing the student. And again, either of those drop-in hours can be a point of contact where students can be provided referrals or be directed to CPS's resources. But not all students need one-on-one counseling and may instead be seeking more skills-based interventions or seeking a sense of community, albeit virtually, particularly during the time of amplified isolation with the last 18 months of this pandemic. And in those cases, we have over 20 support spaces facilitated by members of our team, ranging from identity or affinity-based to skills focused for specific symptoms such as anxiety, OCD, bereavement, procrastinating, to resilience and preventative support spaces such as our cultivating creativity space or our mindfulness and meditation workshop. And finally, specific to this audience, as Dr. Goldfield had mentioned, anytime you might be concerned about a student, you can always call CPS to consult with one of us, and we can make suggestions on next steps to support that student. You can also bring students to our office on Learner 8 if you're particularly concerned about them, and they'll be seen for a same-day appointment as soon as possible. So there are many ways for your students to connect with us, all of which are detailed on our website, as well as ways that you can receive support managing student mental health concerns. You don't have to feel as if you're suddenly a trained mental health professional. We're here for them and for you. And with that, I'll hand it over to my colleague, Dr. Holder, who will focus on ways to be taking care of yourselves as you navigate your teaching roles this year.
Thank you, Weiyen, and please feel welcome to ask any questions of Weiyen in the Q&A. We will be opening up for Q&A shortly. Next, we have Dr. Aisha Holder, clinical psychologist at Counseling and Psychological Services, Columbia Health, who will remind us of the importance of caring for ourselves so that we can do the important work of teaching and supporting our students.
Thank you, Susanna. Hello, everyone. It's a pleasure to be part of this important discussion. Before I share a few self-care strategies, it is important to acknowledge that we've been living with so much uncertainty over the last 18 months with COVID-19, as well as ongoing social and political issues, both domestic and foreign. And as we begin this semester, returning to on-campus life, it is equally important to acknowledge that this represents a transition, and transitions, as we know, come with uncertainty. Transitions can occur during moments of difficulty and during happier periods of life, both of which can produce unexpected stress on our psychological well-being. The encouraging news, however, is that we can be proactive about our self-care during transitions with compassion, patience, and grace as our foundation. So what is self-care? It's certainly a term that has been frequently referenced over the last year and a half, and there are various definitions of self-care, but it's generally referred to as paying adequate attention to one's own physical and psychological health and wellness, and taking an active role to preserve, protect, or improve our own health and well-being. In addition, the World Health Organization's definition of self-care acknowledges the role of families and communities in promoting and sustaining health. And this too is important to note. Self-care has also been described as an ethical imperative, where it is viewed as an ethical obligation to maintain competence in certain professions. It is not surprising that self-care offers a range of benefits in boosting physical and emotional health, from improving sleep, enhancing concentration, strengthening relationships, and managing stress. Yet we may experience challenges in practicing self-care, which can be explained in part by the myths we have about it, which would be noted in the slide about common myths about self-care. One myth is that self-care is an all or nothing option. Some believe that self-care only represents spending all day at a spa or vacationing on a Caribbean island. Now, while both represent excellent and really fun ways of taking care of ourselves, they don't solely define self-care. Self-care can represent small moments like taking a deep breath or going for a walk in response to stress. Indeed, it is the cumulative impact of these small moments that can have a positive effect on our well-being. A second myth is that we have to earn the right to practice self-care. This is the notion that we have to accomplish our goals before we can take care of ourselves. Just the opposite. In fact, self-care practices give us the energy and the fortitude and nourishment we need to be productive and to accomplish our goals. Another common myth about self-care is that it is selfish and that we have to choose between self and others. When we don't take care of ourselves, we can be left feeling depleted physically and emotionally. When we prioritize self-care, it allows us to be more effective in being of service to others. The last myth that I'll reference is the idea that self-care is optional. This is related to self-care being described as an ethical imperative, as referenced earlier. Self-care is not a luxury, particularly for helping professionals. And your role as educators can be viewed as a helping profession. Your work involves a complex, multidimensional, interactional process in which knowledge is exchanged and used to foster the development of individuals and societies. Chronic stress can leave us feeling emotionally disconnected, and this can impair our creativity and our ability to exercise flexibility in our work. Therefore, we can redefine self-care as something that is an integral practice that is necessary to facilitate success as educators. The next slide will talk about strategies for managing self-care. A key first step in managing self-care is monitoring our stress level and how it impacts us physically and emotionally. We want to pay attention to getting adequate sleep, nutrition, and exercise, which really represent the building blocks of wellness. Consider creating daily routines around these areas. Again, adequate sleep, good nutrition, and exercise. Another self-care practice is to validate what you're feeling. And this is very important. Try not to judge or criticize your feelings. Emotions are not good or bad. It is how we respond to our emotions. For example, anger can make someone throw a chair across the room or prompt someone to register to vote. Think of your emotions as information. And observing our emotions instead of judging them allows us to gain insight into how to best care for ourselves. Another self-care practice is connecting with our communities. Connecting with with people who demonstrate empathy and understanding can remind us that we're not alone during times of transition. Think about ways to establish consistent times to see family, friends, and colleagues. Self-compassion is a powerful tool for caring for ourselves. It involves treating ourselves the same way we'd treat a close friend who's having a difficult time. Self-compassion involves self-kindness in being warm, comforting, and understanding towards ourselves instead of being too self-critical when we experience challenges. Self-compassion involves being aware of the present moment and acknowledging that the human experience is not perfect and that we are not alone when we encounter adversity. The practice of gratitude can be helpful in promoting wellness. Being grateful can represent a chosen attitude in times of triumph and adversity in our lives. Being grateful does not mean we deny difficult feelings during times of challenge. Being grateful can help us think about how we can transform those challenges into a greater good for ourselves and others. Lastly, self-care can involve seeking professional support, such as speaking to a therapist. We don't have to be in crisis to seek professional support. For example, the Employee Assistance Program is an excellent resource to support your personal success and help with everyday challenges. In closing, as you continue to explore self-care strategies, here are a couple of questions to consider in identifying your own priorities to support your self-care. What perspectives and strategies have supported you in the past when managing change? And in what ways might those approaches apply during this transition to on-campus life? And in what ways do you experience a sense of belonging and connection when you are with others? How might you utilize these experiences to develop and maintain healthy connections during times of transition? Thank you, and I'll turn it over to Susanna.
Thank you, Aisha, and please feel welcome to ask any questions of Aisha in the Q&A. We will now open up the conversation to address your questions, so please keep those questions coming in. We have a first question that has come in that is around the emotional labor that faculty have had to do since the pandemic has started. And the question is, what guidance can you offer to faculty who are completely drained at this point, especially those of us who have taught 4 semesters online? Agreed about empathetic listening, but that becomes very exhausting at this point. So just opening it up to our panelists, welcoming any ideas, thoughts, strategies here that would be that might be recommended to support faculty in handling the emotional labor that is involved in the teaching and learning endeavor.
I'd like to say a few words about that. I do appreciate what Dr. Holder just shared about self-care, and I think that is really, that responds to the first part of the question, but the second part of the question about empathic listening being exhausting. You know, obviously this is our meat and potatoes as clinicians, but faculty really can get something back from helping students by being supportive. It's a part of your job in a way to get to know your students, and they are very attuned to their emotions and their emotional life. So even if it feels exhausting, the response that you get, I hope, will give you a sense of gratification that you really have made a difference. And I do want to say that I've heard from so many students over the years that a caring response from a faculty or a TA has made a big difference in their experience at Columbia. So try to remember that even when it does feel like another draining moment in your day. Thanks.
Thank you, absolutely. At the Center for Teaching and Learning, we actually have an initiative called Thank a Professor, Thank a TA. And I will say that oftentimes those messages, the students basically say things like, I'm so grateful for my professor for actually listening to me. So absolutely validating that is a really important thing. And whether you're doing it in office hours or before or after class, students really appreciate being heard and also being connected to resources that are available to them on campus. So I'll let someone else also, if they would like to address that question as well.
I was going to say the question certainly does resonate. And I think what I would offer is to, as much as possible, be very intentional about your self-care. I think about for myself and certainly my colleagues, where we're listening to students, we're providing support to students, many hours in the day. And I think about how can I, provide that support to myself as I'm sitting in my office. So a very practical example can be to engage my senses, right? So I have lavender oil, that's an infuser that's going in my office right now, making sure I have imagery that really supports what I do and trying to create an experience of comfort and care. So I think being intentional about our self-care and thinking really moment to moment to moment, how am I nourishing myself so that I can be of service to others has helped me personally in managing burnout. It's been a long 18 months. So the question is very heartfelt.
Thank you, Aisha, for sharing some of your personal self-care practices. That's wonderful. And I think also as part of your presentation, you highlighted the various resources and supports that we have available through the university as instructors and as staff of the university. So making sure that we also engage with the resources that are available through the Office of Work Life, but also through Human Resources. So always reminding ourselves of those wonderful resources. Anyone else want to share their self-care strategies or things that they would recommend to faculty to handle the emotional labor? No pressure.
Cadbury's chocolate is mine. I haven't had my annual trips to England, but my family has been shipping it over. So I have to balance that with my exercise routine. But they always say, give something back to yourself. So I agree wholeheartedly with what the other panelists have shared. And I just think that acknowledgement across the board that it doesn't matter what you've done in this, if it's teaching online, if it's having, I have medical staff who were in person early on in the pandemic. It is, you have to give yourself that time and that moment to refill your cup, however you do that.
Absolutely. Thank you so much. Definitely emergency chocolate stash in all locations is something that I know for myself and for my colleagues here at the CTL, that is a common practice. So thank you. Anyone else want to share how they support themselves through the emotional labor that's involved in doing all of this work?
Just to add to what some of the other panelists had said, that, if you're feeling as if you are recognizing something is out of your capacity in terms of energy or empathy, then just knowing what other resources are out there and just knowing that we're here at CPS, you can always call us, like I'd mentioned, and there's all these other spaces that students can, reach out for being heard. And
thank you all so much. Another question that we had come in was around the resources that were shared today. So I just want to remind our participants that we will be following up with an email that will include resources as well as a link to the recording of today's session. So just wanted to put that out there. So we don't have too many questions coming in, but I will invite folks to continue adding any questions to the chat. We can definitely follow up in our follow-up email with any of those particular questions. But I would like to ask this group. So I know that when faculty have a concern that they can reach out to you. So is the best way to do that to call in or to, what's the best way, or directly reach out to particular individuals? What's your recommended approach for someone that has a student that they're concerned about?
I think you just need call. It's the easiest way. And I would, if something is, there may be a particular reason to try to speak with a member of the team in particular, but if something is emergent, everyone is capable of giving at least some preliminary guidance and advice. And I think it's a mistake to wait to speak to a preferred colleague when things are feeling very urgent. You can always speak to that person later on. As I think Wei said earlier, we're open long hours. We open 8 a.m. and we close at 9 p.m. during the week. But when we're not open, there is 24-hour, 7-day-a-week phone support. So that's another reason for using the phone. I know it's antiquated technology and students don't have any idea that the thing that they hold like this actually is a telephone, but it is best because it will get you to someone immediately. Whereas if you email, those of us who are not of the youngest generations don't necessarily walk around like this all day and might not see the email. So that would be my recommendation. Certainly if something is less urgent, then email is fine. And I should add that last year is obviously an unusual year, but in ordinary years prior to the transition to off-campus learning, we would field something along the, the order of 2,000 consultative calls a year. So it's a big part of what we do. We welcome it. I'm fond of saying that we certainly know how to deal with a crisis. We can do crisis intervention, but I much rather do prevention, much rather speak to people early on. And as I realize it's trite, but it's true, there are no foolish questions.
Thank you so much. And absolutely to contacting as soon as one has a concern so as to be proactive. Thank you so much for that. We have a question that came in for Dr. Holder around self-care practices and recognizing healthy self-care practices that are nurturing versus those that perhaps are more on the numbing side or trying to kind of deal with that sort of weight. And so numbing behaviors. So any guidance on that, if at all possible?
Sure. I think that's an important distinction, that there's self-care practices that certainly can make us feel good, but not all things that make us feel good are constructive. So what we're talking about are constructive self-care practices. So being mindful if we're noticing we may be drinking more alcohol, spending habits may be a little bit out of balance, things like that that really can have a sort of an adverse impact on our lives, then that is something to pay attention to. And as what was mentioned before, think about seeking professional support if it's something that you find is getting in the way of, what would be sort of healthy functioning. I think the key when we think about constructive strategies, as Melanie mentioned about chocolates, chocolates are great. We want to find balance, right? If we find that we are solely seeking comfort with food, again, in a way that feels like is overwhelming, that's something we want to pay attention to. So I think it's balance. I think it's being aware of the impact that strategy that you're engaging in is having on your life. And if it feels like it's moving in more of a destructive direction, to seek support. And that may not only just be professional support, that certainly can be the people around you, right? Your family, your friends, your trusted people in your lives, if you need some counsel. So I think it's a well-noted, important distinction.
So I think we're clear that 1.5 pounds of chocolate a day is the absolute maximum. Anything more than that's excessive. I did want to add, and it may be slightly tangential, but I think it's important that whereas one doesn't, that numbing oneself is clearly not the way to go. One could go in the other direction as well. I certainly recall during the height of the pandemic here in New York, there were people who were watching cable news, 16 hours a day, watching the mortality figures and so forth. And I would say that there's a point at which one does need to divorce oneself from all of this. It's not to say that one shouldn't be an actively engaged citizen and care about things. And, as I said, when I gave my presentation, not just the virus, but everything else that's been going on in this country the last 18 months. But there is a limit, and there's a point at which it shades into something that is not productive, and that may in fact remove deactivate someone because it's so overwhelming, which is a point I was going to make earlier as well, that understanding to the question about faculty exhaustion, understanding one's limits are important too. There's only so much each person can do, and that includes only so much difficult news that one can consume. So I think that sometimes for people who really are constantly thinking about these sorts of things, making a conscious effort to have in effect a news blackout. Also, sometimes people gravitate to other people who tend to be not the most optimistic of their friend network. And that can be a mistake as well, where people just potentiate one another's anxiety and so forth. So I think it's a long-winded way of saying, I think there is a balance between keeping one's eyes open, paying attention to what's happening in the world, caring, participating perhaps in finding solutions, and overwhelming oneself, which can lead to a feeling of helplessness, and if anything, lead one to feel a loss of agency. And again, 1.5 pounds of chocolate, that's okay. No more though.
Thank you. Thank you for helping us set some balance and some boundaries there when it comes to chocolate consumption. We have a final question that has come in around, so we know who to call you all for concerns that we have around students, but what if somebody's concerned about a faculty member who's struggling? So I know that Aisha had mentioned the employee assistance program through HR, but are there other strategies that you are aware of that maybe faculty can be made aware of, or students can be made aware of, TAs, if they are concerned about a colleague or a peer in order to get them the support that they need on campus?
I recently contacted the EAP, the Employee Assistance Program, for a colleague who was looking for resources, and I was delighted with the response. Columbia provides 6 free counseling sessions for each employee and referrals. So it is a really good resource for people to have handy. I think if someone is concerned about a colleague in an emergent situation, we've certainly had them call us and we can help to direct them to the right resources. So, we don't see faculty and anyone who isn't a student for therapy, but we can consult.
Excellent. Thank you so much, Anne. And thank you to all of our panelists today. We really appreciate your time and all the work that you're doing on the front lines of supporting the student population and to supporting all of us in being able to do the important work of teaching and learning. I would like to welcome folks to submit any additional questions, and we will be happy to follow up in our follow-up email again with the recording from today's session, as well as links to resources that were shared. So thank you all so much. Thank you to our panelists and to our participants, and wishing you all a wonderful rest of the semester. Please do take care and be well.